The title of this study is a systematic literature review of the effects of manual therapy applied to neck dysfunction in Korea. The presenter is Hyunseok Lee. Neck dysfunction is one of the most prevalent musculoskeletal diseases worldwide, including in developed countries, and is significantly affected by the working environment, education level, and income level. This is a significant social cost and is a major cause of productivity loss. The underlying cause of neck dysfunction is not clear, but damage to soft tissue caused by poor lifestyle and repeated working conditions leads to neck dysfunction. Manual therapy, which is one of the physical therapy interventions, is widely used for musculoskeletal disease including neck dysfunction, and various techniques are used for manual therapy to improve neck pain and dysfunction. In addition to McKenzie therapy, Kaltenborn therapy, Maitland therapy, Mulligan therapy, chiropractic, there are many other treatment techniques such as joint or soft tissue mobilization, manual correction, corrective tissue massage, facial relaxation, strain counter strain, and muscle energy technique. Many empirical studies have been conducted on neck pain and neck dysfunction based on these treatment techniques, such as various treatment interventions and exercise techniques. But most of them are studies comparing the effects of each intervention. Systematic review, systematic literature review can be used to draw more general conclusions because individual studies use different research methods which can lead to different research results. Systematic literature review is the synthesis of literature with solid research methods and objectives by rigorous methodology on a particularly narrowed topic according to scientific and objective methods. As a result, various studies can be integrated using methods to reduce bias and probability errors. Therefore, this study aims to understand the research status of manual therapy interventions for neck dysfunction in Korea, analyze the characteristics, and evaluate the quality of the research. This study followed the steps of the International Research Reporting Guidelines, Cochrane Library, and PRISMA. It was carried out based on PICOS, a general technical form of literature review. Literature search was conducted independently using 5 domestic databases according to the protocol. Of the 925 selected literature studies, a total of 19 studies were selected excluding duplicate literature, studies not related to neck dysfunction, studies with only abstract and presentations, studies with no manual therapy intervention or other intervention methods, and cases where the same intervention method was applied to different sites. The intervention method followed the guidelines presented by 5 manual treatments, and the intervention method was selected. The quality evaluation of the literature used Cochrane Library's risk of bias tool. Of a total of 19 studies, 3 studies were found to be an uncertain risk for random sequence generation, and 15 studies were found to be an uncertain risk for allocation concealment. In addition, only one study was mentioned for blinding of participants and personnel, and blinding of outcome data was not mentioned in all studies. Incomplete outcome data showed a high risk in 7 studies, and selecting reporting showed a high risk in one study. The manual therapy methods applied to neck disability chosen in this study were found to have statistically positive effects on the change in pain, neck disability, and range of motion. However, further large-scale clinical studies on the effects of manual therapy are necessary because the variation in the number of samples and the duration and amount of intervention can lead to clinical heterogeneity among the studies.